healthresourcedirectory.org.au. Patient Fact Sheet. Depressive and bipolar disorders in children and young people. What is it? A depressive disorder is when a person has low mood, less interest or enjoyment in activities, and other symptoms that have lasted for at least 2 weeks. In children, they may become more irritable and have temper outbursts, referred to as disruptive mood dysregulation disorder, which can be confused for a pediatric bipolar disorder presentation. A bipolar disorder is when a person has a manic or hypomanic episode. Mania typically includes the person feeling very happy and positive, far more so than usual. Hypomania, on the other hand, is when the individual tends to feel irritable and has lost some of their normal energy or interest in life. Either of these conditions need to be present for more than a week. They also may coincide with depressive episodes. Depressive disorders include disruptive emotional dysregulation disorder, severe verbal and behavioural temper outbursts happening for at least 12 months, major depressive episode, low mood or irritability and or not wanting to go out or enjoying it when they do. This lasts for at least 2 weeks. Persistent depressive episode or dyspnea. Low mood most of the day for more than 1 year. Premenstrual dysphoric disorder. Changes in mood, irritability and other symptoms in the week before a period starts and getting better the few days after the period begins. Bipolar disorders include bipolar 1 disorder, presence of manic episode of more than 7 days with or without hypomanic or major depressive episode. Bipolar 2 disorder, the person has hypomanic episodes which last for 4 or more days and has or has had major depressive episodes. Cyclothymic disorder, chronic up and down moods for at least a year in children that may or may not be severe enough to be classed as a depressive or hypomanic episode. What will my GP do now? Your GP may refer your child for treatment. Mild to moderate depressive disorders can be treated effectively with early intervention. A referral does not mean that your child is seriously mentally unwell. If it is possible that your child may be diagnosed with bipolar, your GP may refer you to a specialist for an assessment and treatment. Your GP may also refer you to a counselling service so that your child can learn how to manage the depression. Refer you to a family service to provide family support. Refer you to a specialist service if the depression is severe or if your child might need medication. Your GP will want your child to come back so that they can check how they are improving. If they are not improving, your GP may discuss other options to assist. What questions should I ask my doctor? There's a lot going through your mind, and it can be easy to forget the questions you want to ask your GP. Here is a list of questions you may wish to ask. What can I do to help my child now? What can I do to help my child over time? When should I make another appointment? How quickly can I expect results? What happens if my child gets worse? What can I do? It is important to support your child in learning how to manage their mood. Treatment can often take time. Some of the things that you can do include getting treatment early as it helps prevent any depressive disorders getting worse. Provide reassurance and support to your child. Follow through with any referrals made by your GP, including counselling. Look after yourself. You are the child's main support, and it is easy to forget to maintain good self-care. What supports are available? Public health and other free services. The Infant, Child and Adolescent Mental Health Service, ICA-MHS, provides specialist treatment for children and young people up to 18 years of age. Talk to your GP about this service. The Primary and Community Health Psychology Service provides free psychological assessment and treatment for children up to 12 years. Contact 8788 4200 and ask to speak with a psychology intake worker. The South Western Sydney Local Health District Youth Health Service provides free counselling to youth aged 12 to 21 years. Contact one of their centres and ask to speak to their intake worker. The Corner Youth Health Service in Bankstown on 9726 8633. The Fairfield Liverpool Youth Health Team on 8717 1717. Headspace provides bulk build counselling services for young people aged 12 to 25. Contact one of their centres to make an appointment. In Bankstown, 9393 9669. In Liverpool, 8785 3200. In Macarthur, 4627 9089. Southwestern Sydney PHN Mental Health Services provide 2 services to improve access to mental health services for children and young people. Star for Kids is for children aged 3 to 12 years, and You in Mind is for young people over the age of 12. Both services include criteria to be met and require a GP referral. Speak to your GP about this service and whether a referral would be beneficial. Private options. There are many private specialists and allied health providers that can treat child anxiety. Speak to your GP about rebates for treatment. This information is to be viewed by someone who has received a diagnosis from their doctor. It is not designed to be used to diagnose a condition or as a substitute for ongoing medical care. Health Resource Directory fact sheets are endorsed by Southwestern Sydney PHN's Community Advisory Committee and local GPs.